Hi, I'm Charles Johnson. I'm a registered nurse and I'm in the RN to BSN program at United States University. This class is Health Policy, Regulation, and Finance. The presentation I have for you today is on the National Committee for Quality Assurance. The professor is Professor Daniel Davis. And I'm going to go ahead and talk about the National Committee for Quality Assurance. And it was founded by, and the president of the National Committee for Quality Assurance is Margaret E. O'Kane. The NCQA exists to improve the quality of health care. The NCQA's patient-centered medical home health relationships and their clinical terms. The NCQA continuously keeps up with the changing needs of health care and implement policy that will assist with that change. So as things change, and we know we are currently having different issues in healthcare reform, it keeps up with that changing needs of healthcare constantly. And this is also the reason why you want a NCQA health insurance plan or a company, a health system that follows NCQA guidelines. So, the NCQA standards are a guide for delivering high quality care. So when you get an NCQA plan, you know you have a plan that's high quality and following some guidelines. You don't just want a plan that just doing anything and not really taking care of the people. And it's not that insurance plans may do this, but when you have that stamp of the NCQA, the National Committee for Quality Assurance, you know you have the quality plan. So, NCQA health plans must include care that keeps members at the optimum levels of health, while also controlling costs and meeting government and purchaser requirements. So you know when you have that NCQA plan, you will have a plan that meets government guidelines, and in a way, that's what you want. Now, the NCQA fights racial disparities by providing culturally and linguistically sensitive services. So any provider you have that's credited by the NCQA will provide these services and cannot discriminate against anyone for race, creed, color, cultural background, or language, and they got to deliver culturally competent health care. The NCQA standards help health and wellness organizations identify gaps for improvement and align their services accordingly. So the NCQA also will follow up with a plan or provider that has the NCQA credential and make sure that they are still living up to the gaps, to these services. And if there are gaps, they will go ahead and say, you need to improve in this area, and to be further credentialed with the NCQA. Now, the NCQA allows for health plans that are geared to the patient's needs, including their diagnosis, the education, and socioeconomic status. So many plans that are in NCQA, I know United Healthcare, I know different plans like that. They have plans geared toward diagnosis. They have a diabetic plan. They have plans that are for end-stage renal disease. They have Medicare plans. Whatever the socioeconomic, they have plans for Medicare. And so the plans are geared toward the patient directly. So these plans need to be credited by the NCQA and to meet the guidelines of the particular patient's needs. And when they are, it's that gold stamp saying, okay, this plan is legit and is okay for the patient regarding their diagnosis and their socioeconomic status. Now, the National Committee for Quality Assurance provides a framework for organizations to implement industry best practices that help them accurately and efficiently credential and recredential healthcare professionals. So once they give you the framework, you can I think you can most health insurance companies have to purchase it, but it's available for them to look over and make sure they're meeting those guidelines, make sure that they have the framework to offer a healthcare plan that will be credentialed by the NCQA. So it's not a surprise for the healthcare insurance provider or the healthcare provider when they are applying for an NCQA credential. They have the framework and they're able to follow it. The NCQA Wellness and Health Promotion Accreditation / certification focus on services desired by employer as well as expected consumers. So it focuses on improving its plans to meet the needs of the population, basically. So you'll see that with an NCQA plan or healthcare system. The NCQA credentialing accreditation benefits, influences operational performance and marketplace competitiveness. Organizations who seek accreditation receives resources and support to assist them during and after the evaluation process. Now, if someone wasn't to meet the guidelines, again, they will have that framework, they will have that information on how they can meet the guidelines. So it's not just, hey, you seek the credentialing, but you don't meet these guidelines. Okay, well, we're going to help you get to this level where you can attend seminars, you can have workshops, that you can have people come in to get more information. We're going to help you get there. And even if you already were there and something happens and there's gaps in your performance, the NCQA will help you get back to where you need to be. 3 ways they protect you, the NCQA. And that is the National Committee for Quality Assurance protects you by involving you in your own health care through surveys that rank health systems in your area that basically improves your satisfaction. And I always reminded by like the SHARP experience in my area, San Diego. They NCQA, they have a quality, and the NCQA stamps them and there approves of them, and they have and the people have voted that they have a high quality health care. And so it's a big thing in San Diego to hear about the SHARP experience. The NCQA accredited health plans that deliver high quality and enforce important safeguards to protect the people they cover. So they have high standards. In that way, when you're a consumer, you know if this plan's been stamped by the NCQA, that they have high standards and they met them standards. The NCQA provider network accreditation creates a framework for organizations to provide efficient, accurate, and consistent network management and credentialing services. So it's always ongoing. You always know that they're meeting these guidelines, not half the year, not part of the year, but they're always consistently meeting these guidelines. And recredentialing also means that they met them in the previous year, and they must continue to meet guidelines, and there could be no gaps in the care that they provide. So some standards health systems must pass to receive NCQA accreditation, and let's look at that. Quality improvement. So they must always be into quality improvement, basically improving their care, population management, making sure they get effective care, cost effective, and the care is of high quality. Utilization management is basically they're using the resources and the plan to meet the needs of the people in an effective manner. And credentialing and recredentialing, they gotta continue to meet the standards of the NCQA, and they have to respect the member's rights and responsibilities of the member, and let the member know what their rights are and what their responsibilities are, and member connections, and reach out to their members and offer the benefits and tell the members about their benefits, and Medicaid benefits and services that offer high quality benefits to the low socioeconomic populations, and meet those needs of the population. So when you have an NCQA health system, you know you have a quality health system. And I keep reiterating this because it's very important. I know when my daughter lives in Texas, and I have to pick out her health care plan, and I have to look at it, and I know one thing I know right away: this provider is NCQA, this health plan is NCQA. I know that it's a quality health care plan, and this is all throughout the United States, and moving along probably internationally. So, and when I look for a healthcare plan, I make sure it has an NCQA stamp myself, and that's how, I know these are the standards that they're going to provide: quality education for the consumer, and quality improvement, and high quality plans, healthcare plans, that is. So let's read here. The NCQA exists to improve the quality of healthcare. NCQA credentialing accreditation evaluates organizations providing full scope credentialing services that determine if it meets the standards to serve consumers within the healthcare industry. You already know that if it doesn't, it won't pass them. So 175 million people are enrolled into an NCQA accredited health plan, and that you probably are as well, because most employers want to offer the best plans that are cost effective, and using those resources, as I talked about, utilization review, making sure that they need the care that they're getting, and they're not overspending or underspending, and they are really taking care of anyone who might be even socioeconomic, have low socioeconomic means. They have to meet the standards of the NCQA. Often when one is looking for a healthcare plan or even a provider, they look for that NCQA accreditation. I tell you, you can't miss it a lot of times when you're looking through the book for your provider. It has a little NCQA stamp of approval, and this proves that organization strives to provide healthcare within the standards of the NCQA. So I took a lot of this information from the National Committee for Quality Assurance, and I had a author, as you can see, but I just want you to take away that if you have an NCQA plan, you have a quality plan. I thank you for your time, and I hope you enjoyed my presentation, and you have a wonderful day. Thank you.